A journalist from The Intercept went to a private health insurance conference, and I want to show you some of what he said here. The CEO of Aetna paid $41 million a year, slams single payer, and also lies about it. $41 million. $41 million a year. That's fucking unbelievable. And he says, after I asked the Aetna CEO about single payer, I was told to leave the conference. Wow. By the way, I don't know how to pronounce his name. I've heard it pronounced multiple ways. There's Li Fang is the phonetic spelling, but I've heard people say Li Feng is how you pronounce it. I really don't know. But he's been doing some fantastic work, and this is, some of it right here. So I want to show you how little this CEO knows, because it's stunning. So remember, he gets paid $41 million a year to be the head of a private for-profit health insurance company where the whole business model is we make more money, we pad the bottom line, the more we deny paying people's claims. So you deny coverage for care, you deny paying out on claims, and you make more money. There is an incentive structure problem 101 with private health insurance. Look, there are areas where I don't think there's an incentive structure problem, and I'm not as anti-capitalist as perhaps some people in my audience would like me to be. But healthcare is one of those areas, and health insurance is one of those areas where there is a massive incentive structure problem, and as a result of that, you're ruining people's lives and bankrupting them over medical bills. Medical bills is one of the top causes of bankruptcy in the United States. Medical bankruptcies don't even exist in other modern nations. I mean, think about that. That is so wild. So listen to how little this guy knows, because it really shows you how broken our system is. That you got a guy like this making $41 million, and he doesn't know the first fucking thing about the health insurance and healthcare system. So here's what they say in The Intercept. Bertolini, speaking at the Strategic Investor Initiative Conference in New York on Tuesday, in response to a question from The Intercept, said that the Sanders single-payer bill does, quote, nothing to fix the underlying cost structure of the healthcare system. So if we refinance a lousy product, what do we get? A lousy result, Bertolini said. The Aetna CEO also ridiculed proponents of single-payer, suggesting that they are confused. Some supporters, Bertolini warned, are in fact talking about socializing all the hospitals and doctors. Everybody's going to work for the government. He asked the room of investors and analysts to name a country that has single-payer. When several participants named Canada, Bertolini disputed the answer and claimed that Canada has a government-run healthcare system. They're not single-payer, they're single-everything. Okay, what the fuck is this guy talking about? Let's break this down. So, from the top here, he says, Bernie's bill does, quote, nothing to fix the underlying cost structure. Huh? So if we refinance a lousy product, what do we get? A lousy result. What are you babbling about? It doesn't fix the underlying cost structure. What does that even mean? It doesn't fix the underlying cost structure. Here's what I know. If we don't do Bernie's single-payer system, over the next decade, our healthcare costs $49 trillion. If we do Bernie's healthcare system, it costs $32 trillion. So you cover everybody for less money, and there's better outcomes because every other single-payer system in the modern world has better outcomes. So what do you mean? There's nothing to fix the underlying cost structure. See, that's something that somebody says when they don't know what the fuck they're talking about. He's filling the room with noise that sounds official, but he's not actually saying anything. The problem with single payer is that there's nothing to fix the underlying cost structure. And if you ask me, the coefficient of the restitution of the deductible is something that we should heavily consider and take into account. You're not fooling anybody. You're not fooling anybody. Okay. Then he goes on to, so ironic, accuse Bernie supporters of, they're confused, as he proves that he's confused. They're talking about socializing all the hospitals and doctors. Everybody's going to work for the government. Name a country that has single payer. Okay, so when he says some people want to socialize everything, well, that's true. But he acts like, where do they have that? By the way, he goes on to say, it's Soviet Union. This ruined the Soviet Union. First of all, the United Kingdom. repeatedly ranked in the top 5 of healthcare systems in the world. They have socialized everything when it comes to healthcare. So everybody is employed by the government, and so it's public funding for public institutions, in other words. So it's public funding for, when you go to the hospital, but the hospital is also owned by the government. The doctors are paid by the government, so they socialized everything. And they have a perfectly lovely system, way better than our system. So he presents it as if it's like something that doesn't exist, but it does. And he also kind of presents it as if it's something that, it couldn't work because nobody really has it, but they do, and it does work. So he's just wrong on multiple levels. Tell me again who's confused. I'm pretty sure you're confused. And then he goes, when people named Canada, he goes, no, not a government-run healthcare system. They're not single-payer. They're single everything. Okay, that just sounds like Trump. Yeah, see, the problem is it's not single-payer. Single-payer, tremendous. Look, understand. They're not single-payer. They're single everything. It's unbelievable. What does that mean? They're not single-payer. They're single everything. The way The Intercept interpreted that is they said, oh, that's him saying that Canada is run. The Canadian healthcare system is run in a way where everything is socialized. But that's actually not true. So the Canadian system is public funding with private providers. And that's the way, for example, the single-payer system in France is run as well. You have public funding for private institutions. So whereas the UK is public funding for public institutions, and like the doctors are employed by the government and the hospitals are owned by the government, you have in France and in Canada, it is public funding for private institutions. So it's privately owned hospitals, privately employed doctors, but all of the funding comes from the government. That's what a single-payer system is, and that's like, for example, Medicare. So he doesn't know what the fuck he's talking about. The way the Canadian system works is single-payer. It's not public funding of public hospitals, clinics, public employed doctors. So he doesn't even get the basics of the way the Canadian system works. He doesn't understand the different kinds of single-payer systems there are. And he gets paid $41 million a year for being a health insurance company CEO. If this doesn't show you how broken the fucking system is, nothing's going to show you. And I'm not kidding when he goes on to say, compare single-payer to the Soviet Union. Here we go. Yeah, I know. Anything that has anything remotely to do with the government, you bring up fucking Cuba or China or the Soviet Union or Venezuela. Again, it's the classic straw man, because when you ask people on the left, hey, what systems are you trying to copy? They will fucking tell you Denmark or Norway or Iceland or Sweden or Australia or Canada or the UK or France, or they'll tell you that and you go, no, you mean China or the Soviet Union. But we don't fucking mean that. Stop fucking saying it. God damn, man. Guy who gets paid $41 million a year to be a health insurance big-time CEO doesn't know the first fucking thing about healthcare or health insurance.